Pretty nice view, isn't it? Kind of calming in a way. And that's the whole idea behind the Stanford Cancer Center South Bay, putting the patients first. In other words, patient-focused care. And having a view like this makes going through treatment just a little bit easier to take. Now, we know a lot of you can't get down here to the new center because of your busy schedules. So we're going to take you on a behind-the-scenes tour of this incredible facility, which brings advanced care here to the South Bay. So what's happening behind me? It's a drill here in the infusion treatment area. It's kind of like spring training for opening day. And to borrow from that baseball analogy, since I am a Giants fan, is that they went into extra innings to make sure everything runs smoothly for when the first patient comes through these doors in the summer, including these infusion chairs, all tested and approved by patients. Well, Linda Tennisketter knows all about testing and approving. She's with the Patient Advisory Council, who helped design this new center. Linda, thanks for joining us. Can you tell me what this new center, what makes it so unique to patients?
Patients have had their hands in many of the design features and the flow features of this building. So while it will have coverage of all the things a cancer patient might need, it also has a real connectivity to community within the space so that it's an easier journey.
Checking in one too many times, especially for a cancer patient, can be pretty stressful. We've got a solution here. It's called a one-time universal check-in. And we have with us here Ardiana Madzar with Patient Access Services. So tell us about universal check-in.
So patients come into our building and they are able to register at any registration area one time. This will have a better patient experience and reduce the wait time for the patient and family members.
So it's all mapped out for them at the very beginning.
Exactly.
The clinic here on the third floor is a prime example of seamless coordination in a healing environment. For example, you've got the private consultation rooms here on the left, and then here on the right, dual entry exam rooms. Now the key here is that the whole team comes to you. Hey Sarah.
Hi.
This is Sarah Dunlap, a nurse coordinator here at the Cancer Center. So why is it important to have two doors instead of one?
One of the benefits is for the patients as they're being led down this hallway. It's a private hallway. So it's just going to be the medical assistant and the patient. They're not going to be running into their doctor or nurse or social worker as they're being roomed. All of the staff team is going to be housed on the other side of the door in the work core.
And when you talk about the other side of the door, let's see your workstation over here, how this helps you to be better coordinated.
Definitely. So we're all located in one area. The whole team is here. It's easier for us to see when a provider is done with the patient and when the next person needs to go in to greet them or when they're able to go home.
And then you have a real-time locating system, right?
Yes, we're very excited about this. So basically all staff members and all patients will have a real-time locating system that they have on their shirt, and it'll let us know who's in the exam rooms, how long they're in there, and it should help with patient flow. And then also, for example, if a patient's in there by themselves for 10 minutes or longer, it'll alert the staff members to go in, to check in with them, reassure them, and let them know when they might be seeing their provider, so they're not by themselves the whole time.
Open coordination. That's what the center is all about. Multiple doctors from multiple disciplines combine on a single floor to reduce the stress on a patient. For instance, you have pre- and post-op recovery rooms, private rooms to respect a patient during care. Is there a doctor in the house? Of course there is here at the new Cancer Center. In fact, we have Dr. Patrick Swift, the medical director of the new Cancer Center, and also the director of radiation oncology. So tell me, doctor, how does this new workflow help you as a physician taking care of your patient?
It speeds up the whole process immensely and gets an increased cooperation between myself and the other physicians that are taking care of the patient. So for instance, if you were diagnosed with a screening mammogram that showed an abnormality, we needed to get an answer as quickly as possible. Your physician can make arrangements for you to come to this location right here and in one day have a diagnostic mammogram, an ultrasound, an MRI, and a biopsy. And from that, we could come up with the answer to what we need to do. And if it involves surgery, we have the ability to do surgery right here.
Imagine what it took to get this big piece of equipment into the new Cancer Center. But that's what it's about here, the latest and greatest in technology. We're talking about CT, PET-CT, MRI, and something called the linear accelerator. Yeah, say that 3 times. But what it's about is the patient and giving the best care possible. Dr. Val Van Delsum is Medical Director of Outpatient Imaging here at the center. So why is it so important to have state-of-the-art technology for the patient?
Lisa, that's a great question. By having the best equipment, we're able to provide the patients with the scans that have the highest resolution, the fastest scan times, and the lowest radiation dose. And we are very excited to be able to bring those capabilities that we have at Stanford down here to the South Bay.
So there you have it, a sneak peek at the new Cancer Center South Bay. You've got state-of-the-art technology, world-class care, and seamless coordination all under one roof, designed for patients by patients. Patients who are up at bat, staring down cancer. Hopefully we can make rounding the bases just a little bit easier.